Hello and welcome to In Conversation with the history holders of the American Dance Therapy Association, a project made possible by the Marian Chace Foundation. My name is Dr. Jacelyn Biondo. When I first conceived of making these videos, I hoped to capture the words of the women who studied with the firsts in our field: Marian Chace, Trudy Shoup, Mary Whitehouse, Alma Hawkins, Blanche Evan, and Lillian Espinack. What culminated in the process was an opportunity to have these women share their stories and their memories in their own words, and to capture these parts of history for future generations. Thank you for joining us, and I hope you enjoy our conversations. So I am really excited to have with me Iris Rifkin-Gainer in our conversation today. Iris, welcome.
Thank you so much.
Really excited to talk to you today, and we're going to jump right into our questions. And the first question I have is, with whom and where did you begin studying dance therapy?
Well, a long time ago in 1947, when I was 3 years old, I began creative dance classes with Blanche Evan in New York City. And it was just happenstance. A little girl I played with in the playground on Riverside Drive hadn't shown up on several Saturdays. My mother said to her mother, "Oh, where have you been? We found this wonderful dance teacher for my daughter." My mother said, "My daughter loves to dance," and that was the beginning. And so I worked with her. I was her student in creative dance through my teen years. And during those years, she was moving towards her work in dance therapy from creative dance. And so I was really along for the ride with that. And the age that I was, and as I was maturing, coincided with her movement from creative dance to dance in therapy to creative dance in therapy to dance as therapy, until she was finally willing to use the term dance therapy, and was actually involved with the ADTA in the earliest stages, and then was less involved. So I then worked with her in many different studios in New York City, in the New York City area, for those many years. And she started out on 8th Avenue and around 56th Street in New York. Interestingly enough, Joe Pilates' studio was on the same floor. Oh. And at that point, his work was certainly known, but hadn't really touched the dance world or the dance therapy world as much as it has in these decades. And she was at that studio for many years. And then moved to various places. She had a studio in the St. Mark's Theater. I'm in that same building, as well as on 14th Street and 5th Avenue, on the Upper West Side. I mean, we moved around a lot. And then she also did a lot of teaching in California, teaching and training in dance therapy, teaching her work, and also working privately in both groups and with in groups and with individuals. I did not follow her through those locations, but she was always touching base in New York again. And so we continued in our work right up until her death in 1982. That's the answer to question number one.
Yeah, so it sounds like you really had this kind of journey with her with regards to all the different iterations of how she moved through creative dance all the way into dance therapy.
I did, and she said, there's an interview that was published in the ADTA journal in 1982. I think it surfaced shortly after her death. She did die that year, in which she said, anyone who wants to know about her work should read The Child's World. And The Child's World is a little packet of articles that she wrote for Dance Magazine in the 1950s. And each one touches on a different aspect of creative dance, including her pedagogy, the influence of dance in cultures all around the world, which differ very much from our culture and our culture at that time. it's absolutely true that all of the main kernels for her work are in those concepts and those approaches and that pedagogy. And so I was there as a child. And this is one of the things I just want to refer to some notes from this morning. I wrote for myself some of my earliest memories of dance, expression, catharsis, musicality, body mastery and challenge, language development, and worldview. I mean, considering that a 3-year-old is exposed to all of those things. And so then I lived with her and with her work. I don't mean in her home, but lived with her and her work throughout my lifetime up until 1982. There were times when I wasn't studying with her or working with her or working for her constantly, because also my life took different turns. But I can hear that in my own thinking. I can hear that in my own language when I work with clients or when I teach.
Going back to that list you were just sharing, I wanted to see if you could talk a little bit more about 2 words that really stuck with me, or 2 phrases. One was catharsis and one is body mastery. And being in an identity development time, being in that space of your life that you're really starting to kind of come into yourself, I was really struck by the fact that you used those 2 words, or the catharsis and body mastery, as phrases of what was happening in that point of your life. Oftentimes when we're that age, we don't have awareness of that. So I was just wondering if you can speak a little bit more about that.
You're absolutely right. I don't think at that age I was aware of catharsis as catharsis, or of body mastery as a developmental task, or what was going on in the classes. But because the classes were based in dance, and they were always based in dance, where we did learn certain skills, but we didn't learn any style in those skills. We were not learning ballet. And Blanche did think that if a student was serious and was continuing in creative dance, by 10, they should have some introduction to a very pure Cicchetti-like ballet. But we didn't learn any style. We just learned how to use our bodies. We learned about differences in time and space and parts of the body, how they moved together, how they moved differently. We worked with music a lot. We worked with drumming a lot, with other instruments collected from around the world. So it was always dance at the center. And so we were learning skills. This involved a certain element of the work that carries through into dance therapy, which this refers to several other questions at the same time from the interest of the interview. But she really did include technical work as very important in terms of learning to use the body, ultimately expressively, not because the technical work was expressive in the way that a Graham vocabulary, the technical work, is very related to the Graham expression. This was very pure, how the body can move, how the spine can move, what are the varieties of using the arm, what's a straight arm. And this carries through into the therapy too, which is really unique to the work. So when I talk about body mastery, we did little exercises, basic things like hip lifts, body arcs, body bridges, which I think are common to many other types of creative dance of that period that were not highly technical or performative dance. And we learned how to use our feet, how to articulate the toes, how to use the foot with the toes all curled under, with the toes all overextended, how to walk with block-like feet. And for the children, there was often imagery, whereas later for the adults, that was not imagery. That was exactly what's going on with your foot. So in terms of body mastery, this was something that was ongoing as part of the class. We always had some of it. It was not distasteful. It could be challenging. It could be difficult. And as we worked, we would get slightly more difficult versions of, the same body bridge, but done a little bit differently, releasing one foot, releasing one hand. And so there was both the sense of going further, of accomplishing what I just kind of glibly referred to as body mastery, but of gaining control of our bodies in ways of learning to do new things, more difficult things, stronger things. But that was integral to the rest of the work too. It wasn't like a separate thing. It was a little separate section of the class, but it was all very organically developed. I think we started with swings, with arm and body swings, which probably every dance studio of any kind in the world of modern dance was doing in the 1940s and 50s. And with a focus on the freedom of the swing and of shifting the weight, being full with the movement, and of different qualities, different tempi in the movement. So that was all in that same category. When I talk about catharsis, I'm sure I didn't know what catharsis was until decades later in my life. But that sense of having the opportunity, whether it was with percussion or with music, or simply going across the floor with a repetitive rhythmic action of putting oneself into movement and experiencing the coming together of actually moving, of a rhythmic pattern, of a build in energy, of release through that movement, and the kinds of feeling, the respiration change, everything that happens as a result of that. So not necessarily of naming a feeling, expressing it, letting it go, and feeling that cleansing release, but of all the things that I just mentioned before, of the energy sense, the respiration, the build, the excitement. And so that's what I'm referring to now as cathartic. But often there were emotional themes. And again, with the children, often there were images with this. So, and some of these images did survive into the dance therapy years, but something like an image from nature, rather than saying dance fire or dance music, but presenting the whole field. And I still do this in my work with adults. Choose an image from nature so that it's given to the client, to the student, to the client, rather than imposed. Whereas with the children, the image might be offered itself. But even the storm is one of the best possible, because there are so many elements from that, of the wind and the space and the sound. And then as we go on into how creative dance gets moved, or how Blanche Evan's version of creative dance gets moved into the therapy, then there's the question of the qualities within those images, expressing the quality, or being oneself in the presence of that image, and what the feelings, what the associations are. So that goes far afield. But I think those are the kinds of things I was thinking of in terms of body mastery and catharsis, and then body mastery and challenge as well, that there were some of these physical exercises that were difficult. And so they could be a challenge. And so after a certain number of weeks, maybe it was achievable in a fuller version. And this is similar, though not at all based in, but a lot of us are familiar today with the Pilates work, where it's totally adaptable to any level. And you do it at the correct level for your body. You don't push yourself to another level, because the idea is to do the movement purely, clearly, with total respect for your own body structure, strengths, weaknesses, ability, age, any of that. And so this functional technique, which is what she eventually called her technical work, did that. You know, as you learn to use your leg, they're the most basic possible ways of doing it. And there's no stigma in starting at a lesser level of technical ability if it's right for your body.
So it sounds, Iris, like you had this extraordinarily unique entry into working with Blanche before dance therapy was even in your mind, and then you kind of grew with the progression of her work. But what was it that specifically drew you into the field of dance therapy? What was that entry into it for you, into doing the work?
Well, it's very hard to separate that whole process of growing into it with her. And I think I used to say I fell into it. Well, I don't know that I fell into it, but I swooned into it, or I rolled into it, partly because of the timing for me developmentally, being a very young adult, as she was actually entering the area of dance therapy and honing her work and focusing on the psychological content. I mean, there was a demonstration which she did, which was called The Psychological Content of Children's Dance. And this was presented before she called herself a dance therapist. So getting back to me and what drew me, I think I was totally immersed in that experience for myself as part of my life, as a kid and as a preteen and as a teenager. And I had the advantage of living in New York City. So having this marvelous opportunity for special high schools in New York City, I had, without really knowing what it would entail, I had somewhat of a dream of going to performing arts as a dance student. Despite the fact that I had done technical work with Blanche, I knew that I wasn't a strong technical dancer in terms of conservatory training or that type of dance. And yet I did audition there, didn't get in. It was still a good experience, and ended up going to music and art high school. And I've always loved music. I was not a natural musician. I am not a natural musician. I think I'm naturally musical, but I'm not naturally a musician. And I always felt whatever level it was, whatever format it was, I have been a natural dancer. That doesn't mean I was, ready to be a performing dancer myself for my life's work. But I knew that this was one of the most important things in my life, for many reasons, on many levels and for many reasons. So it just seemed very inviting to me as I got older and was asked to be an assistant in a class and saw how Blanche's work was evolving, extremely complex and creative and intellectually stimulating as well, and vivid and inclusive in many ways. And, the list could go on and on. So I did sort of fall into it because I was being exposed to more and more information and more ways of utilizing the work, finding the depths within dance and how that offered the ability to express feeling, to deal with issues and problems, to change the body in positive ways while growing in a therapeutic way. And seeing that also around me in the groups and the classes and clients, patients, students, there are various nomenclatures. Maybe in that context, it should just be clients and students as opposed to patients because of the setting. And so I think it was always attractive to me. And even though I did end up going to graduate school at University of Illinois as a dance student, which was a great experience, I still felt that the dance therapy work was the richest way for me to go, and was fortunate in having a connection that suggested that I applied for a job at N.Y.U the year before it was actually a program. So the rest is history, as they say. And then I did have some exposures to dance therapy other than Blanche's work, and the development of her work from creative dance to dance therapy to dance word therapy as she was playing with it at the end.
Can you share a little bit more about what your experience studying dance therapy under Blanche was like?
Yeah, as I said, it was very complex. She did do courses of various kinds, which were fascinating. She developed them herself. They were largely experiential, but there was also a lot of reading in different avenues of psychology, of development, of, Darwin, all the basics about what it is to be human and to have affect and to have feeling, shoulder, and to have a body. There were people from all over the world. They were small groups. And in those, she really was very open to hearing and accepting where these people came from, what their current work was, what their history was, and how her approach could be useful to them and be taken in a creative way that was really true to the essence of her work, but that would help them grow and would bring the work to other parts of the country, other parts of the world, in an extremely generous way. One of the main things about working with her, and I took one of these courses, even though I had had a lot of exposure as a trainee early on. I took many of them, but I took one that was kind of the introduction to this. And just to see how much she had done in preparation for teaching, drawing from every aspect of her work and her thinking and the current moment, and her philosophy about the individual, that the individual is an individual, and that the therapy process is very much about helping you become you, not helping you become what someone else wants you to be, or what society says is the norm, or what dance says is the norm, or what your introjected mother and father say is the norm. And having very creative ways to do that, and presenting experiential work that was very complex, but also doable, that was not just feeling, move the way you feel, without a connection to a verbal directive or a verbal question that was both pointed and accessible. I know that's not giving an example. I know examples are helpful. That may be something I have to come back to.
Sure.
So that was one of the main things of experiencing, seeing her actually creating her work, both the pre-session work and within the actual session, in the kinds of questions that she asked to each participant, and in the kind of directives, verbal directives that she then formed that continued the thread of what she was having us work with, but that also took very much into account who we were and what was going on. And related to that is she would give a verbal directive. And this is something that I've done in my work for many years. A group would be moving. And in the structure of her work, group work was mainly people moving in a parallel way, not a lot of interaction. Sometimes a chosen theme where there was interaction and working in twos or in a group. That was much less usual. So it was mostly some kind of a warm-up suitable to dance therapy, not just a dance warm-up, then some kind of thematic work or a question or a directive, whether it was in the movement exploration portion or the mobilization portion or the thematic portion. And then while everyone is moving in their own world way of using the directives, she would ask further questions without speaking to an individual person. But what about the back of your body, the back plane of your body? Who, me? If you're working in this group, who is that directed to? Doesn't matter. Everyone then either does or doesn't take that awareness. This is very random what I'm doing, and not necessarily would be part of a particular experience. But is there anything in the actions you're doing right now that reminds you of a family member? Not just out of the blue, would be more in connection with thematic work, but to be able to work with a group in that way, but individually, and to be able to enter as the therapist in that way, so that it can be taken or not taken. I think it's an incredibly powerful way of working.
It
So
sounds like, oh, I'm sorry.
No, go ahead.
I was going to say, it sounds like you're already moving a bit into the next question, and maybe you can clarify or shift or add. But I'm wondering what specifically about Blanche's teaching stood out to you the most as a student?
She would not be there just to present the work and to stimulate us to move and explore our inner worlds through movement and through directives. But she would also be developing in those moments. She would be seeing what we were doing and feed that back into what she had brought to us. And that would take her then further, and she would be stimulated by what was happening in the group. She wouldn't be lumping us together, but she wouldn't only be singling us out. Also, in a session, she might single us out. She might kind of amble over to someone and ask a question or suggest something further. So it was a very intricately composed kind of way of working with a group. And the individual sessions are different, obviously, and that's a whole other area. When you're asking about working with her, or was it studying with her or working with her?
Studying.
So studying with her was being invited into her process, not just, which I mean, I'm sure this is true to a degree with all dance therapy, or I would hope it is, that it is, that the leader is really in the process as well. It's not just presenting something that's already structured. To have a format, to bring it in, to work with it, and to elaborate it, to shape it, to change it with diverse members who may need other things one from the other. So that's something that really stands out.
It sounds very, her teachings to me, I'm hearing that it sounds pretty structured but simultaneously improvisational, in that there's this kind of cycle of like witnessing and taking, drawing from, and then giving that back in a way.
I think that's right in a way. When you say witnessing, a little voice in me says, no.
Oh, sorry.
No. But I mean, we can still use, which brings up another thing about her, which is the use of words. Yeah, it's almost a participatory witnessing, and it's being in several roles at once. It is leading the group at the same time as resonating, maybe is resonating, and let that resonance then going into a thought process that's not super cerebral, but then brings in another possibility for movement and for expressing it. And the little detour I took there was about language and about being very careful and respectful about language. And we actually did have, at times, a blacklist, as in the sense of forbidden words, simply because they were overused, or their connotation was something that had been limited by current culture, or those of us who still do her work, have a chuckle when we use that, because that phrase, because it's, the words would have changed by now, definitely. I think that's another thing about, because I worked with her for so long, that's another thing about her teaching and her work in general that impressed me, was that the tenets of her work remained, I would say, very consistent throughout her lifetime. But they changed very much based on, A, the client, the person, or if not individually, the general makeup of a group, which would be true for any dance therapist, but also on the times, because she was very focused on working with the individual within the family constellation, and the individual within the society. And within the society, I think also now, as we talk about her work, there was a sense of individual cultures within that society. she did make very clear points about the individual, the family constellation, and society at large. And that meant looking at what we are surrounded by. What is the media doing, and how are we reacting to it? How are we contributing and reacting to it? And this went back as far as the creative dance years, the early creative dance years, and became crucial when working with adults and working in dance therapy. The idea of acknowledging, which is something that's happening very broadly now, acknowledging how media and how social media are affecting human beings' lives, young women in particular, diverse population, whatever the focus is. And so that's something that's intrinsic to her work. So that grew with her work and changed. And that's why this many years later, the 82, 19, 30, 40 years later, 40 years later, right now. Well, it'll be 40 years later in December. So not 39 years later. That approach still works. Like we're not dealing with kids having fire drills, not fire drills, atom bomb drills and going under their desks, which we had in my day. But there are equivalents and possibly worse things going on, and they're loaded, and everybody is reacting to them, children too, adults, our childhoods, and what we bring to our adulthoods. So this idea of social elements affecting us is super important. And I think I got there from the question about what struck me about her teaching, was that where we still were? Yeah, so she constantly drew from all these aspects, but if you were a client or a student of hers, it wasn't just your personal life, your current personal life that was being examined. It was everything about your life, and then your connection to your family constellation, which I think is true in all good therapy, as well as the society around you and the history of this society that has been around you. And that was all material that was then drawn into creative work. What are the qualities of that factor? Can you be those qualities? What are the feelings that arise when you hear that, when you see that? Can you move those qualities? Which circles back to something else. I think, again, important in the teaching is that it was always based in dance. And so what are the elements of dance? So we hear them, time, space, force. I'm thinking of how she described them, so I'm losing that link, but time, space, dynamic, that would be force, body movement itself, and content. And to do that, you have to have a growing knowledge, an ever-growing knowledge of what movement is, and how the human body moves, and how your own body moves. And so that's always a part of the work. So that's very different from the thematic work or the historical work, but they all intertwine. And so she used the word linking at various times in her life, and those of us who are still doing her work really do find that a helpful term, so that the physical work, as in a very pure technical work, the exploration of movement itself, the movement elements as they comprise dance, and then the expressive components and the embodiment of other elements in one's life, whether they be personal history, familially related, or societally related. So all of those are the things that stand out. Try to make a patchwork of what's most important about her work.
Which actually is one of the other questions that you're touching upon, and maybe we can just kind of find a salient bit of information to answer is, what would you say the essence of dance therapy is as you understand it from Blanche Evan?
Dance therapy, as I understand it from Blanche Evan, derives from dance and from your expressive and psychophysical integrity of your individual human body. So it's not just the human body, and there is so that it really takes into account any human. So, and so the work is on your body, so that whatever that technique is that's taught, it's not to make your body like a different body, it's to make it your best body. And best, not in terms of skill, but in terms of support of the structure that you have. And that would include your body from anything in your body resulting from injury or from habitual use of the body that is engendered from emotional, whether it's trauma or stress or familial identification that develops from early on. It's really about your body, but also knowing what the human body can do and does, and then relating that to your own body. And learning very specifically about that. It's like, oh, my legs are weak. Well, let's see, are your legs weak or do your legs feel weak? And if they are weak, do you want to strengthen them? Well, how do we strengthen them? And then from that, associations with the weakness and the strength of. So it is hard to put it in a nutshell.
I really love that idea of the individual focusing on the individual self, right? That it is a very intimate experience with oneself. It sounds that the exploration and then it makes sense when I think back to the other things that you had listed with specifically catharsis and body mastery, the two that I was drawn to, and how when we are not comparing or when we are not ranking or when we are not setting parameters around what should be for a group of humans, but rather focusing on an individual body and individual capacities and practices. It's a really beautiful thought.
Yeah, and that definitely was always her way of working. And she also did say dance therapy is work. And there was always homework of some kind, not necessarily writing something down, but some doable. And when I teach now, I always include that. Yeah, so it's work. And then also, I think I already mentioned this, but that the basic elements of dance, the time, space, dynamic, body movement, and content, as well as the elements of movement, are ongoing in terms of the development within the dance therapy, so that you may experience them at a very rudimentary level, and then you work your way further in all of those. Well, I think I've already touched on this, the idea of being more yourself, and as you grow in therapy, to have more and more movement possibilities, not in a random way, but based on where you may have had inhibition or rejection of an area of the body, or whatever the source is, that as we grow psychophysically, it is psychophysical. So that to work with the body within the dance therapy is very important, because as we are growing and moving ahead in our therapy work, the body really, our bodies really need to reflect that. And as we grow in our bodies, that can influence our psychological or psychophysical self. I think that's a basic tenet of dance therapy. The movement influences the psychological development and change, and the ability to change, the possibilities for change. And so this can be very, very varied. I mean, it may vary from culture to culture. It may vary from age to age. It may vary from socioeconomic background. But within all of that, there are commonalities that are human, and that because we're working with the individual and with the family constellation, historical or present, and with the social surround. There are ways in that make the work possible as a very rich and individual experience.
Iris, is there a fond memory about studying dance therapy with Blanche that you'd like to share?
One of the fond experiences when I worked with her on this interview that was in the ADTA Journal in 1982, sitting with her, and I hesitate to use this because there wasn't actual movement involved, which, would be so important for her. And the questions, which, no secret, we had some preparation for the questions, and hearing her, and I would recommend anyone who does want to know a bit more about her work, even though it's from the end of her life, but it does refer to much earlier work as well, to read this article, but to hear her kind of recoup over those many, many years, much of which I had been privy to, but to hear how she pulled it together for her interview is a very rich and very vivid. I mean, it could have been, a few weeks ago, a few months ago, a way of remembering the work. I guess that's the one I choose. That is the one I choose.
Yeah, I bet it was having experienced it or moved through some of it with her and then hearing her reflect back, and how perception plays into the conversation is probably a really remarkable experience to have been a part of it, and then to hear in her words as well.
Yeah, especially at the end of her life.
Yeah, absolutely.
Absolutely.
Yeah. How about a particular client or patient experience that was really meaningful for you in dance therapy? Is there one of those that you can recall that you would share?
Well, I guess one is someone I worked with very minimally, but someone who was at the studio and worked with Blanche and several of her trainees and teachers and therapists, and someone who's atypical for the population that Blanche worked with. Not atypical in that there were none, but this was not the norm. She actually worked with what she called the normal neurotic urban adult. And that has interesting implications for today. But this was a very young woman who was both retarded and physically disabled. Those are the terms that were applied to her at that time in history. She came to work with Blanche individually. Her aunt had been client in one of the groups for quite a while. And this young woman was extremely resistant to anything. She wouldn't take her shoes off. She, whatever it was. And Blanche worked with her just very, very patiently and with a bit of a sense of humor. She introduced the kinds of things she would have introduced with other clients, specific movement work for exercises. And because the two sides of this young woman's body were very different, she had to work with that, but unify the work because she's a whole person. To see the changes over the years that happened, not only physically, but attitudinally and in the personality that was able to grow and come through, was amazing, absolutely amazing. And it is recorded. There is some film partly of a reenactment, but also of this young person as a grown young woman. And the fluidity that she was able to gain in her movements. And part of this was, the old scarf trick, working with a scarf, but literally the fluidity where when she first came, she could barely lift her arm. And this is over years of work. So atypical in a number of ways. And to see how this, in some ways, this was absolutely the trajectory of Blanche's work with any patient or any client. And at the same time, it was totally focused on the needs and the body and the personality and the situation and the family experiences of this person. And so to me, I really think that stands out so much. I've recently seen the footage, so it's fresh with me as well. Every element that we've talked about, that it would deal with strengthening the body through simple, basic exercise without style, that developing a range of possibilities of movement, of exploring what it means to move in time and space in very particular ways so that it can be digested by the body and it can affect the body. How those abilities to do more with one's body, whatever one's limitations are, is then very nourishing to the sense of self and enables further growth, both physically and interactionally and socially. And also the introduction of music there, so that is a force in inviting movement and expression. I guess that's the one that I remember the most. And I didn't work with her directly very much, but I knew her through the years and worked with her somewhere.
So as we think about times shifting and the practice shifting a bit, what is it about your knowledge and your experiences of dance therapy that you would like to see carried on to the future of dance movement therapy?
I'd like to believe that there is enough in the core of dance itself that we could find common ground in utilizing it as richly as possible. I hope that those elements of time and space and dynamic or force and body movement and human content are so rich and so variable that however we approach our work or whatever our own personal background is as a dance therapist, we offer it in the richness of dance. I think it remains to be seen. There's a lot of exciting new work. There are a lot of incredibly talented, gifted, and motivated and intelligent and sensitive young people coming into the field with so much to offer that I and those with similar backgrounds to mine don't have. On the other hand, we have some history that was pretty broad reaching, and hopefully we have an ability to learn and to open the pathways and the pathways to each other so that the field can move forward and accomplish so much. Our world is very, very different now than it was certainly when I was growing up, or when I was a teenager, or when I was a young adult, or even when I was middle-aged. So I think it's important that there are changes and that there are people experiencing and developing new aspects to the work. I would hope that dance remains important. I know there's a lot of exciting research going on in neurophysiology and other fields, and I know that's something Blanche dreamed about. She knew there were connections. Her perfect world would have had dialogue and input and sharing of those worlds with the dance therapy world. I hope that we find ways to develop these things respectfully of each other's fields and training and cultures and ways of working, and reaching people who haven't been reached through the power of movement and dance.
Is there anything that I have not asked about that you would like to share, or anything just in general that you would like to share?
Some of us are working with Blanche's materials, written materials and other materials, to try to put something out in the world, and hopefully that will happen. But there are a few of us still working with clients and teaching some. I would hope that people who are teaching in programs and referring to Blanche's work, and I know there are some, would have some more opportunity to experience the work themselves, and yet the possibilities are limited. Hopefully we can do some of that through if we were to come up with some more written materials, and there are people who are still teaching. I guess that's to some degree a regret that less of the actual work itself is not as readily available and hasn't been for some time. So it's out there, but so just acknowledging that fact.
I've been inviting closure of our conversations through some movement. So I'm going to ask if you would like to engage in just a brief bit of movement or dance, seated, standing, wherever, with me to wrap up our time together.
Sure.
Perfect. So I'll just follow your lead.
Oh, okay.
And it can be as brief or as extended as you would like it to be.
Okay. No thinking. I'm not thinking.
Neither am I. Iris, I want to thank you so much for your time, for your wisdom, and for sharing your stories. I really appreciate you participating in this discussion with me.
Well, I appreciate so much, as I mentioned to you earlier, you doing this, taking on this project. It's the perfect time for it, and I'm so glad to be included. Really
of course.
Thrilled. So thank you really deeply.
I'm honored that you said yes and agreed to do it. So thank you.
Thanks.